I think the importance of having PivotHealth involved with what is going on between hospitals and physicians, particularly in this environment, is that PivotHealth is able to bridge the real interesting and dynamic world of dealing with physicians and understanding hospital cultures and getting both of those entities, which are, sometimes have been in opposition of each other, to be able to work together towards a common goal.
Success within multi-specialty means that you need to understand how each physician practices medicine and practices the business of medicine. And how we have been successful is that we do understand, we have the experience of our senior level people and our operational people who have managed in multi-specialty environments, we've managed in single specialty environments. We understand that primary care is a driving force within any healthcare environment. The specialists are dependent upon referrals, and how you manage those physicians is different based on how they are managing the patient and how they manage the business of medicine. So that understanding of how each physician works in their own environment, that's really what has made us successful.
Well, PivotHealth spends a lot of time spending time with the leadership of the medical groups. And we deal with the boards, we deal with department chairmen, we deal with physician site managers. All of these are leaders, and they're critical to the success of whatever it is we're trying to create. Typically, health systems don't have the resources to educate, teach, train these physicians how to do these leadership roles. PivotHealth will come in, and we spend a great deal of time making sure the boards are talking about the right things. We spend a great deal of energy and time talking with the physician site managers. It depends on the situation as to how you address the leadership. If it's a multi-specialty group that's been in place for many years, they already have a board, they already have some leadership, and that doesn't necessarily mean they're good. They still, I believe, need training, they need focus. You have to corral them, make them talk about the right things. If it's a primary care group and you're trying to merge specialists into it to create a multi-specialty group, then there is a lot of discussion around the culture, physician compensation, how the referrals go back and forth, not letting patients leak out of the system because they're not referring to one of their specialists. We know how to talk to them to get them to embrace what we're trying to do or embrace the health system. We try to create a we, not a us and them. And it takes a very particular kind of person who can do that. And so the people at PivotHealth, our staff, all have experience operating things. But it's more than that. They're very successful operators. They have a long history of being successful working with doctors. And I believe the critical thing is we just enjoy it. We like it. We enjoy the challenge. We enjoy the challenge of putting these doctors together, making them play well together, and we're very good at it.
Working with doctors is a challenge, but it's also rewarding because, you know, doctors and administrators come from two different schools of thought. Doctors, from two different types of training, if you will. Doctors are trained to have a patient come in a room and talk about what their symptoms and their problems are, and doctors make a diagnosis. And in a lot of cases, that diagnosis is made rather quickly. Business people on the other side, the managers and the administrators, go to school for business management, and they learn to study, to process, to think, to make recommendations, to look at all the alternatives, and look at the range of solutions for a problem. So their process time is much longer, and it's very different than what a physician, the way a physician works. And so when you put those two groups together, and again the consultant comes from the business perspective, then you have these vast differences that you need to work to come together on. So it's really a relationship building, and it's trying to create a level of understanding. And both sides have to understand where the other is coming from in terms of perspective. And it's crucial to understand that patient experience for the consultant, and for the physician, it's crucial to try to teach them about the business processes.